all the others. Probably hears enough of me. Okay. So I'm assuming everyone can hear me. I'm talking loud anyways, but it's too low. Okay. Bismillah. Today my topic is integrating acupuncture into conventional medicine, understanding acupuncture and how it can maximize clinical outcomes. So first of all, disclosures. No industry sponsors or financial disclosures. I am an acupuncturist. I've owned my clinic for 24 years, and I'm a traditional Chinese medical believer. So I hope you're all having a nice day. How many of you have had acupuncture before? Okay. How many of you have had it in the last 3 years at the convention? Okay. Nice. So at least most people are familiar with what acupuncture is. So I'm going to tell you a little bit about my training. I did 4 years of my Bachelor's of Science in Biological Science. When I graduated, I did another 3 years of my Master's in Acupuncture. Now, with the Master's, you're able to practice acupuncture. About 5 years after that, they opened up a doctorate program in acupuncture gynecology, and so I completed that, and so I'm one of the only acupuncturists in Houston that actually has a doctorate in acupuncture gynecology. Okay, so why are we discussing this today? Why are we showcasing acupuncture as a therapeutic modality? Okay. So according to the World Health Organization report, acupuncture is one of the most widely used traditional medicines practiced globally. And just in the United States, 14% of adults have tried acupuncture. A big milestone that we have is that the Medicare now covers acupuncture for lower back pain. And so now acupuncture is now available to 65 million Medicare subscribers, which is a really big thing for the acupuncture profession that they've included us as part of this network. So the learning objective I'm going to have today is most of you are probably not familiar with Chinese medical theory, and it's very different from Western medicine. And I'm going to give it to you in a nutshell because it takes us probably a year and a half to master the concepts of the body, the understanding of the different ways that it's balanced. And so I'm going to give it to you in a nutshell because there's going to be terms here that you probably have not heard of that are very foreign, and I'd like to give a little bit of insight into some of that. So traditional Chinese medicine is many faceted. So we know acupuncture. That's what is kind of famous. But there's also Chinese dietary therapy. There's Chinese herbal medicine. We do things like moxibustion, which is heating acupuncture points with fire. We do tuina massages. We do cupping, tai chi, qigong, which are energetic type medicines, and just lifestyle consultations and things like that. Next slide, please. So the first thing that we have is the concept of yin and yang, and we see this everywhere all the time. Like, what does it really mean on a clinical standpoint, right? So in Chinese medicine, the concept of yin and yang is kind of one of the most basic things that we have. Okay, so it's the opposing natures. The yin is considered the more passive. It has to do with cold, it's peacefulness, passive, it's nourishing. Yang is more the activity related to heat, it's outward expression, it's things like that. So we say that health is when you have the balance of yin and yang. When the yin and yang is out of balance is when disease manifests. And even Apnama, we have always the duality concept, right? There's harakat, sakanat, rat, din. There's a concept always of the duality of nature. And हमने भी Shahzada Sayyidi Hussain Bhai said before Mayu about nature and taking into aspects nature when we're doing the treatments, right? It's not always about physically what's going on. We have to also look around to that affects health as well. Okay, next slide. Oh, we can go back. Also, if we're wanting to parallel the yin and yang balance, we can look at the sympathetic nervous system and the parasympathetic nervous system. And in that, we're always trying to have the balance between the two. And when one of them is off balance, then that's, again, when disease manifests. In traditional Chinese medical therapy theory, we also have the concept of organ systems and the temperature and things related to that. So when we have too much fire in the body, a lot of times it is the heart that's affected. We have wood, fire, earth, metal, and water. And each element has its own organ manifestations as well. And so when you have, say, a deficiency of the liver, it affects the heart as well. And that's how different things, one thing affects another thing. And so when we're looking at that even, we're looking at something like when you have a weak kidney, which is a water element, it could lead to a deficiency in the liver wood element, which causes symptoms like fatigue and weakness. And even in Islamic medicine, we also have the concept of elements, right? We have Ag, we have Miti, we have Pani, and then we have Hawa. Okay, got that right. So it's still the same, similar type concepts. So each, whether it's Islamic medicine or traditional Chinese medicine, we all have the concepts of the elements. We all have the concepts of duality. Now, when it comes to traditional Chinese medicine, we have something that's called Qi movement, energy movement. And even in Islamic medicine, we do have a similar concept of that, right? Like when we're dealing with anything spiritual, anything ruhani, that's not something you can equate as something you can see, right? So in Chinese medicine, we also have the concept of vital energy or Qi. The Qi flows in 12 meridian systems. And so here's an example of all the different meridian systems. We have the spleen, the stomach, small intestine, heart, bladder, kidney, pericardium, triple wormer, gallbladder, liver, lung, and large intestine meridians. And so, for example, like the gallbladder and liver meridian, we treat the foot to benefit the head. So most of the time when you have any issues with migraines, anything like that, you can ground the energy from the feet to affect the head. And so this is how we can explain that. It's not it's not random. For somebody who doesn't understand the medicine, it's really weird. It's like, how are you fixing my head by treating my toes? But in our understanding of the way that the flow is in the body, it totally makes sense. And so along the meridian systems, we have the acupuncture points. So we have 365 acupuncture points. These are named acupuncture points in the body. And so we go through this big type of manual where we learn all the acupuncture points, indications, and different things like that. And so within the meridian system, you can influence other organs. And from a Western medical perspective, a lot of these are areas where there's a lot of nerve bundles and things like that. And so, when we're trying to, we understand things from a Chinese medical perspective, but when we're trying to go Western medicine, a lot of these are in nerve fibers. Some of these are, BBC did a documentary on it, and they were trying to understand how this acupuncture works. And the second they did a point in the hand, something lit up on the brain. So they did a thermal medical type imaging, and it was like the second this hit, something lit up in the brain. And so there is a very direct correlation between these areas where the acupuncture points are and how it relates to the brain. Okay. So again, this is Chinese herbal medicine, as well as we can say dietary medicine as well. And this is not something totally foreign to us, right? Each food has its own temperature, whether it's hot and cold, the directions, whether it goes up, whether it goes down, the different tastes, and also the channels that it goes into. So, for example, in Ayurvedic medicine, or even in the food that we eat, when we're doing masalas or when we're doing bagais, there's a combination of, say, cumin, coriander, there's black peppers, there's cardamom. These are all warming foods, and they affect the spleen and stomach meridian. And so these are optimal combinations for when we eat to optimize our digestion. So that's in Ayurvedic medicine. Chinese medicine has the same type of principles. We know as ladies that when we're doing anything, Ramadan comes and everybody all of a sudden, before everybody stops eating dates because they don't want to get their period. And so these are different ways that even in our culture, we do understand the properties or the tasir of garam, the tandu and stuff. So it's a similar type of medicine. I know there was a time, maybe about 20 years ago, where ginseng, everybody loves ginseng. We got to have ginseng. It is going to save our life. It's going to give us energy. But ginseng is a very hot-natured herb. Now, if you're somebody like me who's already hot-natured, you give me ginseng and I'm going to have high anxiety. I'm going to be sweating. It's not going to suit me. And so each item has its own temperature property, and it's only going to be optimal for somebody who has the body that's optimal for that. So if you're cold-natured and you take the red ginseng, it's going to make you feel fantastic. Somebody like me, it actually causes other types of issues. And I think in Western medicine, I think that is probably this individualistic type of approach of understanding each person would optimize treatment outcomes. Because, you have a migraine headache. First line of defense, okay, you got to take this medicine, this medicine, this medicine. You almost take 2 or 3 medicines before you get it right. Understanding a patient's composition and the way their body works can optimize their treatments as well. So how do we diagnose? Like, how do we figure out what a person's body is like? So in Chinese medicine, we do the questionnaire like you all do. We ask them about their energy level, their mood, easy to feel hot, easy to feel cold, their digestion, their moods, all these different things we ask them to get an idea of what their body's condition is, whether they're excess deficient. And then we also use pulses and tongue to diagnose as well. Now, with the pulses, say on the right-hand side, we do 3 pulses here. So on the right-hand side, you're checking the condition of the lung, we're checking the condition of the spleen and of the kidneys. And on the other side, we're doing the heart, the liver, and the kidneys. And so it's not like when I'm doing feeling a person's pulse, we're not just sitting there listening like, okay, what's the rate? It's not about the rate. It's about how the pulse hits my fingers. Is it a thready pulse? Does it feel like little pearls under my fingers? Does it feel like it's choppy? And so all of these different signs allow me to understand what overall their organ systems are like. And then that gives us it refutes or it confirms whatever the patient has told us. With the tongue, we're looking at the color of the tongue, the shape of the tongue, the coats on the tongue, and that allows us to diagnose as well. What? You said 20 minutes, right? No, not based on the last one. I have a lot to say. Okay, so what is acupuncture? So acupuncture helps with neurotransmitter release. It helps with nervous system and hormone modulation. And like I said, my doctorate is in acupuncture gynecology, so that is all about hormones. It helps with circulation. You put needles in the area locally, you have an improvement in the circulation. Inflammatory effects, you have better blood circulation, so all the poisons get out. Immune system interactions, myofascial muscular effects, and placebo effects. Placebo effects is just related to, again, energetics. Sometimes you don't even need to do anything with the patient. Listening to them, touching them, caring for them is healing. Okay, next one. So this is, if none of you have had the acupuncture treatment, this is 2 minutes that we'll do it. Yeah, play it. I get another 15 minutes.
Hi, I'm Dr. Rebecca Bolthard. I'm an acupuncturist and doctor of Chinese medicine here at Thompson Healthcare at our Manicotti office. And today I'm going to talk a little bit about what to expect at your first acupuncture visit. So when you come in for your first visit, the front desk at any of our offices will give you a detailed set of paperwork to fill out that goes over everything from what you are coming in for to a whole health history will go over that whole paperwork and talk to you specifically about what's going on, what your main health goals are, and any other symptoms that you may have. The more complete a picture that we can give you, the better your treatment will be, and the more tailored it will be to you as an individual. Your acupuncturist will have you lie down on the table comfortably. Today I am joined by my patient Alice here. And your acupuncturist may ask to feel your pulse. Do you want to feel the pulse on your wrist?
So this is part of the diagnosis, the pulse taking.
And also to have you stick out your tongue. Thank you. You can relax. The pulse and the tongue are two diagnostic methods that we use in Chinese medicine to help us assess what's going on. So they can help tell us internal organ dysfunction, if you have a cold, if there's any digestive issues, just other things where you may not necessarily experience symptoms, but that things might be starting to go a little bit awry, and we can take care of it before it turns into anything more serious. After that, your acupuncturist will determine the correct treatment for you for that day. So to begin, they will always use a little bit of rubbing alcohol to sterilize all of the points. The acupuncture needles are thin and very flexible. It usually feels like a little pinch right at first, but it should go away very quickly. Most people get really relaxed during an acupuncture session and sometimes even fall asleep. So you're going to take a nice deep breath in and breathe out. Once all the needles are in place, you'll relax for about 25 to 30 minutes. This allows for the nervous system to go into rest and digest mode and to start healing on a cellular level. At the end of your treatment, your acupuncturist will come back in, remove all of the needles, and talk a little bit about your treatment plans. Treatment plans can vary based on the condition and how long you've had something going on, and is all tailored specifically to you. Thank you.
Okay, the next one. So the next, I just click that, yeah.
Hi, I'm Dr. Rebecca Folsai. I'm an acupuncturist and doctor of Chinese medicine here at Thompson Healthcare at our Manahawkin office. And today I'm going to talk a little bit about what to expect at your first acupuncture visit.
Okay, you have to go back. Okay, so this is one of the images I found, and it tells about the 10 different aspects that acupuncture treats, and they have a research base. That migraines, mood, depression, high blood pressure, insomnia, menopause, weight gain, low back pain, immune system, acid reflux, and allergies. So these are just some of the things. And now I catered a lot of the presentation into evidence-based. It's super dry and super boring, so I'll go through it real fast. And so acupuncture is known for chronic pain issues or pain issues. That's probably, I'd say, about almost 40% of my practice. A lot of documentation how it helps with chronic pain, migraine headaches, post-surgical pain. And then this is just one of the studies that was done by Memorial Sloan Kettering Cancer Center, and it just had 19 studies with all these participants, and pretty much it concluded that acupuncture demonstrated significant reduction in pain levels related to control groups, and the duration lasted beyond the treatment period. So this is a good study for long-term chronic pain. The next one is, again, acute pain. It was for all different types of pains. A lot of benefits with that. Sciatica, and as well the next one will be prophylaxis for migraines. I get a lot of referrals from orthopedics and primary care for pain issues, especially related to the opioid crisis and things like that, because they're always looking for different natural ways to help benefit with pain management. And that's kind of the boring stuff. My exciting part is 30% of my practice is related to gynecological. 25% is related to fertility. Acupuncture works amazing for when it comes to gynecological conditions. For fertility and just for overall hormonal system, it's great for PCOS. PCOS is not treated in a very good way in Western medical standpoint. they pretty much are given birth control and metformin to just help manage it pretty much at that time. But as far as infertility goes, sometimes we need to do a lot more work to manage that. And I'm trying to talk fast. Also for endometriosis, a lot of adolescents, parents bring their kids during adolescence for things like endometriosis, because the first line of treatment related to that is birth control. And no parent wants to put their adolescent kid on birth control. What I notice is for the fertility patients, a lot of times when they're looked after with birth control during adolescence and they keep taking it to manage the pain, when it comes time to having babies, this is when they have problems with conception. So it's always better to look after things earlier than wait till later. We might be masking things in the beginning and then we have a problem later on. Another problem I have is HIVs. Kids that are doing HIVs, sometimes their hormonal system goes wacky. They're having the periods are too close together, and so I'll have parents telling me, hey, is there a way that you can have their period stop? Okay, we have to look at balance. Like if you have a child that's having frequent periods, like what is the reason? Each kid has their own capacity. Are you stressing? Is this kid getting stressed beyond their capacity? We have to also understand that balance is mind and body. If you are pushing somebody beyond their capacity, are you helping them or not? And solutions like putting them on birth control so they can do HIVs, in my opinion, is not an optimal way to go through this. Okay, the next one. And so I talked a little bit about endometriosis pain. And so, again, addressing things sooner is better than later. Another thing is menopausal symptoms. First line of defense when it comes to Western medicine is putting ladies on hormones. When you're menopausal, hormones is not always the best option because we don't know exactly what things can happen afterwards. Perimenopausal, menopausal ladies are more at risk for having things like cancers. So these are all a lot of times hormonally dependent. Do we really want to be giving people more hormones so you're fixing one problem to create another problem? So that's another thing. A lot of mental health studies related to anxiety, depression, and also acupuncture for a lot of cancer related. So I get a lot of referrals from oncologists. When they're doing chemotherapy, it's optimal for them to use something like acupuncture than giving more pharmaceuticals for some of the side effects, because their goal is to complete the chemotherapy so the patient has an optimal chance of survival or getting rid of the cancer and things like that. So these are just some of the studies. We're kind of having to go through them a little bit quickly, but I have all the research, and I do have 4 pages of references if anybody cares. But I do have, if anybody's interested, then I do have all the references related to this. Again, this is breast cancer survivor sleep disturbance study. The next one is musculoskeletal pain for cancer survivors. So these are all the different things. Okay, so the reason this talk is done is like, how can we optimize acupuncture for our patients, right? And so one of the things, sorry, I'm trying to go through these fast because I can talk a lot and I'm kind of short on time. Okay. Okay, so we'll go back. So for the last one, so how do we implement acupuncture in treatments? I'm not saying for everybody to learn Chinese medical theory and start practicing acupuncture on your patients. The thing is for us to just get an idea about a different type of medicine and understand that everything is about patients. How do we improve patient care? We're healers. We're trying to help people get well. And so what is the best way we can do that? And so one of the ways to do that is to maybe include, I work with many doctors and have a collaborative type team where, I prefer to refer people, say medical doctors. I'll refer my patient to medical doctors that I believe understand this type of medicine and won't look at the patient when they said, oh, I do acupuncture. Oh, if it works for you, that's good. Not caring. If somebody understands something, that's a good collaboration. So for medical professionals, practical considerations, each state has their own rules regarding acupuncture. We have a national body of certification, and each state has their own rules on it. So, it's understanding what your rules are for each state. Evidence and research is important. We have a lot of acupuncture research out there. Some of it's a little shady, some of it's great, but acupuncture works on an individual basis. So the thing is that standardized only works in something like when you're dealing with chemotherapy as the evil agent. And so not all the studies are going to be positive based on the nature of the medicine. Insurance covers, a lot of the insurances do cover, so 80% of my practice is insurance. And so that's a good sign. 10 years before was probably 40%. A lot more insurance are covering it. Veterans are getting covered for acupuncture, things like that. Patient perception, you want to be able to educate patients that this is a viable way for treatment, and it is natural, so it's not harmful. And just collaboration is what we're trying to get at for medical professionals. And so I'll just do the conclusion, since I don't want to take away from somebody else's time. Okay, so in conclusion, sorry, this is all long. Well, I went through this so fast, I'm like trying to figure out where I'm at now. Okay. So final conclusion is I hope you guys learned a little bit about this. One thing, last month my parents were in a severe car accident, and so they did trauma, they were in the emergency, they were in the trauma, and then from trauma they got sent into rehab. And it was really nice to see collaboration in rehab, where we had their acupuncturists come into the rehab facility and actually do acupuncture on them in the rehab. And it was nice to see the doctors around that saw that, and they were pretty impressed with that. The acupuncturist himself was very impressed with, the treatment and things like that. So I think those are goals that is good to have, where if you have patients that are interested in something out of the box, to encourage that for their own health. The other thing is related to proof about acupuncture or any of these natural type of medicines. Look, molato apnu ruhani, we can say ruhani energy all the gani jedua that's also like a spiritual energy, right? And so healing happens on all different regards. It's not just something tangible that you can see. And so proof is in the outcome. Proof is not always in the process. So it's important that when we're doing anything, we're looking at improving the outcome of the patient and not getting fixated at where's the research. The research is patient feels better. There you go. That's what our goal as medical professionals is to make the patient heal and feel better. And so that's just my perspective on it. But I hope you guys learned something. And if you have any questions, I know we're out of time, but I guess we can open the floor for questions. Afterwards? Okay. Sure. Absolutely. Sure.
Just real quick. Can I